This is Dr. Lam. Adrenal fatigue has 4 stages of development, and stage 3 is called adrenal exhaustion. Today, we're going to spend our time to discuss this very, very important stage because this is the stage where most of the symptoms becomes very perplexed and very difficult to resolve from conventional medicine perspective. This full article, Adrenal Exhaustion, is available free at my public educational website called www.drlam.com or www.drlam.com. You can read that at your leisure. You can follow along. I'll try to point out some of the key points here for you to understand and help you to study as you go. Let us review first the 4 stages of adrenal fatigue relatively quick. Stage 1 is called alarm reaction, and this is where you have the fight or flight response. People who are under stress can have an alarm reaction and not even know it. Physically, there are no physical signs to speak of. Sometimes you may be tired, and then you get better and don't even know it after a nap. And usually recovery is relatively fast. If that fails, the body goes into stage 2, which is what we call a resistance response. In this case, the body starts to have some anxiety, the person becomes irritable, insomnia may be common, and infections become more recurrent, and PMS and menstrual irregularity starts to come in. They don't come in all at the same time, and sometimes you can have one symptom more than the other, so it's kind of irregular, but they do show up if you pay attention. Now, if the body's stress are not being dealt with and as adrenal fatigue get worse, then you get into stage 3, which is what we call exhaustion, and you can see it here. Within the exhaustion, this is the time that when the adrenals are no longer able to keep up with the increasing demand of the hormones, and it basically starts to kind of what we call fall apart. What is different from this stage as compared to the previous stage is that the symptoms become so severe that oftentimes it's almost impossible to function regularly, and a tremendous amount of rest is necessary. If this fails and the adrenal fatigue progresses to stage 4, that is when failure occurs, and that could be a medical emergency because the body is basically given up and is really in a survival mode. Unfortunately, most conventional doctors are not well trained in adrenal fatigue to begin with. The most common complaints to a doctor's office is fatigue, sluggishness, insomnia, and they were brushed aside. And adrenal fatigue is not attended to well. Patients are often sent home to self-navigate, and they try their best, but to no avail. And self-navigation programs normally fail, and the adrenals get worse and worse with time. Now, adrenal exhaustion, as we talked about, is stage 3 of adrenal fatigue, and this is where we're going to concentrate on in this paper. Within this stage of adrenal fatigue, there are actually 4 phases that you can divide into. The single system dysfunction, and then that moves on, if it's a little bit more serious, to what we call the multiple endocrine axis imbalances or dysfunction. And the classic example of that is OAT axis imbalance, which is ovarian adrenal thyroid axis imbalance, and my paper will address that in much more detail. If this is oftentimes what brings a lot of the patients to their knees, because they just simply cannot figure it out what is going on, and the bodies keep getting worse. If that is allowed to continue, and then the body gets into a little more serious state where it really enters a critical point of what we call disequilibrium, which is phase 3. And this is the time when the hormones are really so deranged that the emergency system of the body kicks in, and you have a lot of paradoxical reactions with smooth swings, that severe blood sugar level that is irregular, hypoglycemia, low blood pressure, postural hypotension, night sweats, severe anxiety, for example. People normally at this stage have a limited ability to even do their daily chores. It's limited to 12 hours or less. And if this phase is even surpassed, then the phase D comes into play. Phase D is when you really have a more severe situation where the adrenal glands are in near failure stage. That is when the body's hormones are so low that it really has a difficult time to even maintain normal function. My paper will then go through with you each of the phases in great detail and what to expect out of each phase and the symptoms, the clinical presentations, and what usually happens in each one of these phases. I will not go through it here in great detail because it involves a lot of multiple organ system that is dysfunctioning at the same time as you proceed forward. I do want to spend a little bit of time to discuss the phase 3C, which is when you have a disequilibrium state, because this is a state that is so confusing and the symptoms are so convoluted that most people have a hard time understanding. Now, we talked about adrenal exhaustion being the stage 3 of adrenal fatigue, and stage 3C is the disequilibrium phase, and this is where the body's thermostat, so to say, internally is kind of what we call broken. And the body's ability to regulate itself is very compromised. The body doesn't like that, and in such a situation like this, the body activates the autonomic nervous system as an emergency backup plan to try to regulate the body temperature, to regulate the blood sugar, to regulate the salt craving, to regulate the insulin level, for example. But unfortunately, the backup system or the emergency system is very crude, and because of its crudeness, it is not very fine-tuned, and as a result, the ride that the body has to go through is quite bumpy. As a result of this activation, the sympathetic nervous system is in particular, and especially so the adrenaline, is being released in great amount. This is what we call the activation of the sympathetical adrenal system that I'm pointing out here. Now, the consequences of this is that the body then becomes flooded in the sea of adrenaline. And what happens is that the adrenaline will cause a set of reactions that is tremendously difficult to resolve. And it is called the reactive sympatho adrenal response. And the result of this response is quite significant. And it includes things like fragile blood pressure, spaciness, tachycardia, irregular heart rate, an inability to stand for a long time, temperature intolerance, body and fluid imbalances, dizziness, a feeling of impending doom, for example. So these are very significant events that can bring many to the emergency room, only to be told after extensive tests that they are fine. They were sent home, and then it repeats itself. So the clinical picture just keeps getting worse and worse. Now, if this is not resolved, then it goes to the phase D, where the adrenal fatigue is come to a point where it's near failure, and that's oftentimes requires strong medication as well as admissions to the hospital. Overall, I want you to understand that adrenal exhaustion as a stage of adrenal fatigue can be helped. The biggest problem is that most people don't understand how the various symptoms are tied in together. So as a result, the tendency is to treat symptoms by symptoms and forgetting that there is an underlying root cause that is still existing. When you try to only patch up the symptoms, then invariably when one symptom is resolved, you're going to trigger another symptom. There's no end to this. And the more symptoms are being addressed instead of the root cause, the more the body becomes weak over time. And this is almost a self-inflicted wound over a period of time as the body slowly continues to get decompensated and worse. The key to identification as well as recovery from adrenal exhaustion is not any laboratory test, because unfortunately most laboratory tests at this point is simply not sensitive enough to pick them up. What you really need to do is, number one, to understand this yourself, and my article will help you to do that. Number two is to educate your provider if he or she is not attuned yet to this state of adrenal fatigue or adrenal fatigue in itself. Until your provider understands what is going on, it's highly unlikely that he or she will be able to have a program of recovery that is fitting for you. On the other hand, if your provider really understands this, they can usually spot this right off very quickly. Most people do recover from adrenal exhaustion if you are given the right program. At the same time, most self-navigation program fails and only get worse. So my advice to most people is try not to self-navigate if you are at this point of adrenal fatigue. Find somebody that really knows what they're doing, and that is the number one step to your recovery. My article will address all these issues, will give you the knowledge, will give you the tools for you to help yourself if you so want to. At the same time, will give you the tools to help your provider so that they can better help you. If you have any questions after you read the article, feel free to write to me. You can do that on my website. The article, as I mentioned, is on my website, www.drlam.com. If you have a personal attention necessary, as far as personalized program for you to overcome this, you can call my office.